I'll call the meeting to order. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of open meeting law, general law, chapter 30A, paragraph 18, and the governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and general guidelines for remote participation can be found on the Office of the Attorney General web page, and it's posted. No in-person attendance of members of the public will be permitted. Draft minutes will be posted on the town's website as soon as possible after the meeting. Pursuant to Mass General Law, Chapter 30A, Paragraph 20, in an emergency, a public body shall post notice as soon as reasonably possible prior to the meeting. Notice shall be printed in a legible, easily understandable format. It shall contain the date, time, and place of the meeting and a listing of topics that the chair reasonably anticipates will be discussed. Okay. Everybody take a look at the minutes from last week.
Last picture, the video.
Jean?
Yes, I did. There.
Sue?
Yeah, I gave it to my comments.
Okay. I get a motion to approve the minutes for the last meeting, July 2nd, 2020.
I make a motion to approve the minutes of the last meeting, July 2nd, 2020.
Second. Asia, yes. Sue?
Yes. Hey, I'm gonna log off and log back on again, okay?
Go ahead, whatever you want to do. We'll wait for you. Jean?
No, continue doing it.
Okay, we can. Jean, you vote yes, I assume?
Yes.
Okay, fine. Okay, we'll move on. Public comment, 10 minutes. So there are two people from the public. Doug, you have any comment? As a member of the public?
Not at all.
I can't hear. Peter, have anything you'd like to comment on?
No, thank you. I'm all set.
Okay. Doug?
Nope.
Oh, so this is public comment. Is there anything you'd like to add at this time?
Nope.
Okay, let's move on. Health Director's report. Spencer.
Good evening, everybody. My report for July 16th, 2020. Let's see. We had one soil evaluation witnessing at 281 South Long Yard. I had final Title V inspections at 7 Mockingbird Lane, 111 Granville Road, 1 Cody Lane, 12 Tammy Lane, 27 Honey Pot, and 11 Lexington Circle. I approved plans for 2 addresses, 5 Rising Corner and 11 Lexington Circle. I did a food service inspection at the Hash House, a rec camp inspection for Gold Star Soccer. I followed up on the complaint at 4 Nicholson Hill, the one about the horse manure. I was able to close that one out. And I did a moderately extensive beaver damming inspection for down College Highway around 422 to 418, which leads me to my next comment is that I've been looking into joining the Pioneer Valley Mosquito Control District. What it is a district where we would get routine monitoring and for diseases, and then we would be able to a la carte buy into any type of mosquito control that we need. What it does need is to be included as an article on a warrant at a town's annual meeting or a special town meeting for the select board to vote for approval. They've given us some languages for it, and it costs, the annual membership is $5,000. And there's quite a few towns in Hampden County that have already started on it. I've tried to find out whether or not we can use any public health emergency powers to join without a meeting, but I haven't heard back from the commissioner of the Pioneer Valley Mosquito Control District on that one.
What does the $5,000 give us?
It gives us sort of the blanket testing, trapping, and some other types of monitoring, and it basically gives us a discount for if we decide to do any type of larviciding or aerial spraying, if we wanted that.
Tammy, you said it would have to be approved at an annual or special town meeting. Doug, do we have any of those in our near future?
Not at this time.
Okay, would they do it for one article?
No, I
Okay,
wouldn't think so.
I think it's too much money.
I think, okay, Jean, what do you think?
I would like to see more detail on exactly what is inclusive thereof.
Okay.
So my view is that we're not gonna be able to put mosquito nets up around Southwick. So if we kill every mosquito in Southwick tomorrow, tomorrow we'll have all these mosquitoes back.
But if we test for positive for mosquitoes for triple E and West Nile virus, we'll be able to effectively know when to tell people to stay inside
Well,
or when to change the times that soccer teams are playing and things like that.
listen, I understand that. How many cases of triple E do we have in the state?
Right now, it's just the beginning of triple E season, and they're only starting to get the tests in mosquitoes right now.
Okay, so.
But last year we had a very high season, and we're anticipating that this year's high. But it doesn't usually peak till late August, September.
Okay, well, I guess.
But I will come back with you with more information on it. But seeing as it's not really something that we can work on right now, I figured I would just kind of bring it up.
Okay,
This came in front of the Board of Selectmen last year or the year before.
Oh, it did?
Yeah, they elected, if I recall, and my memory is not so much very good, that they decided not to undertake it. So maybe it might be worth a query to Carl or to someone to dig through the minutes on it, because I'm pretty sure it came up.
Oh, okay. I was talking to Carl about it the other day, and he hadn't known about it, so I was going to bring it up again.
Okay, I'm almost positive, but like I said, my memory's not what it used to be.
Dave, you want to
That's
say
all right.
something?
Yeah, is that an annual fee?
It is an annual fee,
Okay.
but it might change depending on how many municipalities continue
Who's
to
that
join.
go to? Who's that 5,000 go to?
Yeah.
A commissioner who and employees.
Mm,
Public employees? Are they part of Pioneer Valley or the private company?
It's a private
Yeah.
sort of like consortium that we had put together. Mosquito control districts are throughout the state, and you have to have so many, I guess, a population of so much area and so many towns in order to join one and to get the benefits of them. I could either get the information or have one of the members of the mosquito that are heading it up. Right now, it's municipally West Springfield and East Long Meadow are sort of the two members who are kind of heading it up and being the liaisons for the other towns. So I can get more information from them.
Did you also find out how many towns around us have joined?
Oh, I thought I knew the number in my head, but I think it's something like 10 or 11. But it's all Pioneer Valley. I think it covers Hamden, Hampshire, and Franklin,
Yeah.
the larger area.
One other thing, I'm sorry, if anybody's recording this beside on the Zoom, they need to let us know. Okay, I'm sorry. Tammy, go ahead.
That's okay. But so in the meantime, because we do have a lot of standing water issues due to beaver damming, I'm looking into purchasing some mosquito dunks to put in standing water. They're basically they're a bacteria that are only deadly to mosquito larvae and are harmless to other living things like people, pets, birds, wildlife, and fish. And they've been approved for use in animal watering troughs and fish habitats. It was something that was a normal practice I did quite often in Chicopee.
Sue, what do you think?
Where are you gonna put them and what exactly are they and how much are they?
I can get about 100 of them for $100.
I think it's good.
And
Jean?
what are they? What are they? What are they made of?
A bacteria called BTI.
I know, but are they put in plastic? What are they?
No, it's like a giant Alka-Seltzer.
We've had those before.
So they're tablets.
They
Like a
did that once
tablet,
before.
exactly.
Oh, okay.
Has it been proven not to be harmful to any animals?
Yes, it has been, and it's on the EPA registered on the EPA website. It's not harmful to any other insects, any people, pets, birds, wildlife, or fish.
That's a lot cheaper than $5,000.
Yeah, so I think,
Yeah.
I think that at least we should start with that as a minimum. And if it gets bad, then we can revisit the $5,000. I mean, at this point, when there's no town meeting on the board, I don't think the Board of Selectmen are, and Doug, I can't speak for you, but are going to be very receptive to spending $5,000 on joining a collaborative, number one. But I think the $100 out of our own pocket is well worth it.
Mm-hmm.
Hey,
Jean?
with these tablets, would you be putting them in a public? water?
It depends. If
private?
if people were having problems with, like, what I'm having right now is there's problems with beaver damming, but if you can't pinpoint the dam or the location until that happens, there could just be a lot of standing water that runs off from the brooks, and for things like that, culverts, whatnot.
How
In the
about,
past,
how about
use
people that
them.
have private ponds?
I would rather them purchase their own.
Okay.
I mean, if it's something that we're having a hard time, say, contacting them and people are worried about the pond, then it's something that I can go bring them the materials. I've used them for people who, with green pools who are vacant, things like that.
Can I get a motion so let Tammy purchase the 100 so we can get started? Please.
Dean?
Yeah, I'll make a motion to allow Tammy to purchase the mosquito repellent or pellets or whatever they are.
Mosquito dunks.
Yeah, okay.
I just got dunks.
Love it.
Okay, second, all in favor, Jean? I mean, Sue?
Yes.
Jean?
Yes.
Yes, okay. There you go, Tammy.
All right, thank you. It's
Good
a
enough.
simple solution that might make some people happy who
Mm-hmm.
who want me to take down their beaver dams, and that's not going to happen. Okay.
What account, what line item would be? Supplies?
Actually, it might not even come out of our account. I was talking to Carl that there might be a way that they can, I'm not very savvy, I'm sorry, about the ways of the budgeting, but it might not even be something that comes out of our account.
As long
But
as
I'll
you-
let everybody know how that goes. I mean, but it's still, I guess under line item. I'm trying to think of what would be the best one. Even if we had to, we'd have $100 for it in supplies, I'm sure.
Go buy them, Tammy.
Okay. The cheapest ones are on Amazon, so I'm gonna have. No, it's true. Like,
That's awesome.
yeah, there's somebody who's got an Amazon account in town, so I'll have them do it and then send the money over, make a PO to them.
Tammy?
Yep.
Remember, it's better to ask for forgiveness than for permission.
Rock on, girl.
That was a Jeopardy answer, by the way.
Tammy, on that note, can you provide us with a copy of the fiscal year 21 budget?
I certainly can. Yes. Make that note.
That would be great.
Thank you.
Okay.
Pillowcases.
Tammy, okay.
Okay, just writing notes. Writing notes. Well, sadly, that's it for non-COVID related topics. Let's see. So I have been doing some COVID compliance inspections. I did one for Tribal Life CrossFit and one for Hash House. Let's see. I am continuing to answer questions and help people put together policies and plans for a myriad of different things. Outdoor events, sporting events, performances, weddings, indoor events at reception halls, fitness centers, museums, road races, but that's not going to happen this year. It definitely takes up a good part of my time. There's also, I guess, another topic, Kate, you wanted to talk about was the 14-day travel advisory that's going around.
Yeah, sure. So there was I'm not going to say a concern, more a question that came from a town employee that was asking me about another town employee who went and traveled to a hotspot state and then came back to their position. And that brought up the question about quarantining. So quarantining is an advisory in this state currently. So the New England states do not have that advisory. So if I go to New Hampshire and I come back, I do not need to quarantine as an advisory. But if you go to the hot spot states like Florida or New York, it's a recommendation, but it's not enforceable. So the person said to me, well, what are we going to do? And I said, well, I can bring it to the board, but really there's nothing that we can do to say to that employee they have to quarantine for 14 days. Okay. So
Go ahead, Kate.
yeah, so let me just finish. So a couple
Sure.
things that came up. So, what are the expectations? Should that employee get tested, which would be covered by insurance? You don't need a prescription. Do they, go out on leave if they're symptomatic, which they may or may not be symptomatic. So they could be asymptomatic and still be technically positive. So it brought up a question that I could not answer. And I brought it, I told the person I would bring it to the board for some dialogue about what's the best practice for our town.
So I can tell everybody what policy myself and Carl Steinhardt put together in relation to the travel advisory. We also had to bring it up to town council and bringing it up to the unions and the union reps. And we're just going off of the fact that it is an advisory and it's not a requirement. And we're also going under the assumption that our municipal employees are essential, therefore essential employees can work through a quarantine given the correct precautions. So currently, if you travel out of the state, we will not be enforcing the 14-day quarantine.
Does that include, Tammy, a hot state?
That includes a hot state.
It does, okay.
But there is currently a bill in the works that might make it a requirement. And if that's the case, I guess then we have to take it back up to town council and how we would effectively, I don't know if we can ask employees to take their personal time, whatnot, but we are asking them if we did tell them we had to take 14 days, is it something that we need to cover? So that's something that we have been talking about, but it hasn't become a requirement, so we're not going to be enforcing it yet.
Okay, I just want to err on that side of because we are in a pandemic, that it's not just about us. And because we do not know if you are contagious or not, and there is no vaccine to protect someone, I think we need to be very careful as town employees that we do not put people at risk. And that is my, as the person that's talking to people and families and people that are in ICU and ventilated, that is my concern, that it's just not about the person flying to Florida and coming back. It's about, is there potential exposure to people even though you don't have a positive case? So I just need to be really sensitive to that. And if there's something that, certainly that if a town employee is getting symptoms, they should absolutely, leave, which I think is in an order already, leave the work site, call their primary care, get tested as soon as possible. And that's one part of it. So I understand the advisory part, but I also want to be very careful that we do everything we can to minimize people's exposure.
And we're working very hard in town
Yep.
hall doing that.
Yes.
And that's, as part of our policy when we had to go through the self-certification, these are all things that we put up. And so for the case of, say, people who go out of state, I've given department heads the paper, basically the best practices for working under quarantine, which really are the practices that all the employees should be using right now anyway.
Right.
So it's not really redoing anything. This is how we should be working. We should be working with masks. We should be social distancing, washing our hands and sanitizing. So it's not anything we haven't been used to. And I'll tell you that the employees are doing a really good job.
I have a question. Would it be an intrusion that employees get their temperatures taken before they come to work every day?
It is not something that that many organizations are encouraging. Because it's considered a medical examination.
Well, this may be different for, and again, I haven't looked at this carefully, for spas or manicurists, right? Or people that do manicures and pedicures.
Yeah, they take
So
my
I go
temperature.
to a place in town, I sign a waiver, I sign in and out, and they take my temp.
Yeah.
And that's for, and they're not, they have the glass walls and they're wearing gloves and you have to wear the mask. So I'm thinking, what is the minimal best practice for people in our community to make sure that they're protected?
I don't think it's outrageous to have each department take care of their own employees every day. And it's not a big, it doesn't take a whole lot of time. And you can make a record of it. And it's certainly one thing we can do as the Board of Health. When I go to my hairdresser, she takes my temperature. And
I put a lot of effort into researching the taking of temperatures, and there's so many liabilities that could come up in this litigious day and age that it doesn't seem worth it, especially when there's unions involved. And everybody was given the direction.
okay. Well,
The
whatever happens,
COVID
happens.
directions about not coming in with a fever, about staying home if they're feeling ill, alerting their supervisor so that we can take the precautions in-house.
So,
If they don't come in because of a fever or they have some kind of symptoms, that may not be COVID, but could be symptoms that you get when you have COVID. What are they're not penalized or anything like that? You don't use it for sick time, or how does that work?
If they're awaiting a COVID result, no, it's an administrative. They're out on administrative until then.
Do you have
Right, so-
anything to add about the temperatures?
Oh, I went to my dentist and they took my temperature. It was 92.
Yeah.
So I'm not exactly confident that these devices are accurate to begin with.
So you have anything to add?
At the hospital, if you're over 100,
Right.
then they consider that significant.
Okay, so let's get back to what I brought up about taking the temperature of town employees. Sue, what's your feeling about that?
And I work in the hospital, I think it's a good idea that everybody is monitored. You know, they read what the symptoms are. Someone asks them, do you have any of those symptoms? No, I do not. Okay, here's your mask. And then they take a temperature. But who would be taking the temperatures? They don't record anything.
The thing is, we all go through different doors. We hardly ever come across each other in the building. We're very separated. Nobody's coming in one door. We're each coming in 3 different sides of it. Everybody goes in and out, in and out. It seems there's not one sort of hot spot where someone can stand and take the temperature all day long. That's why I don't think it's practical.
Well, I just want to take it once. I'm not taking it all day long. Jeannie, what do you think?
But we also come in different doors at different times. So I don't honestly think it's practical.
Okay.
If you want to create some kind of document that the employee signs, then fine. But as far as somebody monitoring every single employee coming in and going, and I don't think it wouldn't logistically work.
All right, let's move on. Okay. There-
Can I just also add that some people are presenting with atypical symptoms. So I had a person today that had diarrhea for 2 days and was COVID positive. So it's not just about the temperature, the cough, the shortness of breath. It could look like flu, right? For this person, 66, and thought it was stress, etc. And the primary care said, get tested, and he was positive.
Is that a Southwick resident?
Yes. Yes. So, what is the criteria that would potentially be a flag to say, maybe you should go get tested? It's not just a temp. It's other things too that I think everyone should be aware of, because there's things that I see as a public health nurse that I would not have expected. So what is that going to look like? If someone has diarrhea and a cough, they call their primary and they say, okay, go get tested.
Well, I think that that's the route. I don't know how much else we can do except what we're doing. I propose the temperature thing. I don't think it's going to work. What I hear from the rest of the board.
Yeah.
So I guess we all do the best we can. And
Yes.
see where it falls. I mean, Massachusetts had 11 cases today, 11 deaths, and 142. So we've actually probably crushed the curve. Is that what they say?
Crush it.
Crushed the curve,
Mhm.
So unlike Florida that had 10,000 today again. I guess we're doing the best we can, but you never
Right.
know.
I just want people to be prudent with how they feel and minimize the exposure if there is one.
So Tammy, have you heard from any other employees that felt they were uncomfortable around either town hall or around town hall with another person that they thought might have either been sick or maybe shouldn't have been at work?
No, I got to tell you that a lot of employees will personally call me to ask me if it's something that they should go to the doctor. I'm not a doctor, but if they said, I have a sore throat or whatnot, I'll tell them. I mean, maybe it is, maybe it isn't, and they'll go to their doctors. And if they do need to take the time off, which it has happened, and it's luckily for some people hasn't turned out to be
Right.
COVID. It's just something else, and it's every department's been pretty supportive of that until we find out, because I think everybody wants to be safe. So it hasn't been it hasn't been an issue.
Kate, are you all set with that now?
Yeah, yes.
Okay, I'm glad you brought it up. Okay, let's move on. Tammy?
So just the last little thing is that I've been talking with Cindy Sullivan, the Council on Aging, and we are going to start researching and looking into planning a flu clinic for the fall. I think it's not only important to be planning for flu, but also by looking at how we have flu clinics, we can be preparing for whether or not in the future if we have to have mass vaccination clinics for the COVID. So I think it's sort of a good, in a way, a test run, maybe not quite, but just something that it's kind of to look for on the radar for the future. And
My question, and this is going to be limited to just seniors who live in town?
well, this would be the I think it's. I'm gonna mute. I'm gonna mute.
So Tammy, is it going to be exclusively for Southwick seniors?
Southwick seniors.
So this has come up before, the last couple of years, and the board had been of the opinion that the town shouldn't take that expense on. Sue, is that correct?
Yes, because when we did hold a clinic
Mm-hmm.
and we got the doses, nobody really showed up because people can go to CVS, they can go to their primary care.
Yeah, we won't be paying for it. Springfield Pharmacy will be.
That's not my point. Jean, what do you think?
Who's going to administer it?
Springfield Pharmacy.
Oh, so we refer them, oh, they're gonna come on site, Tammy?
Yes, they would come on site.
Gotcha.
But it would be
Okay.
a good time to kind of practice like a flow. I think I talked about the last meeting. One of the things that, just we're kind of shooting at ideas like if we had to set up outdoors, things like that. I'm not saying that it would be a drive-through, but that could be an option. Just sort of
Mhm.
kind of playing around with the notion of what mass vaccination can look like, and with Springfield Pharmacy providing everything and doing all of the insurance, so that's great.
Sue, what
Right,
do you
because-
think?
Why Springfield Pharmacy want to do it?
They get paid.
They were supposed to be coming to a health fair, I think that the senior center was going to have, and they just, I've never heard of Springfield Pharmacy before,
Me
but
either. Me either.
it just was someone that they had been working with, this Council on Aging.
So Sue, it's not free. It's free to the recipient and to the town. Springfield Pharmacy will bill Medicare.
Right, which is great.
So it's just another piece of the pie that they get, as opposed to Walgreens or CVS in town, who shipped it out of town. So, yeah, I don't, like I said, the last couple of years before Tammy came on board,
Yeah.
the board was reluctant to have these flu clinics.
Mm-hmm.
Sue, has your mind changed? Was because of COVID and the dress runs, or you think we should talk about it some more? Would Tammy should talk with Cindy some more?
I don't know. What do you think, Jean?
Well, I think, Jerry, you mentioned Medicare, so you're talking about people receiving this who are 65 and older only?
I don't know. Whatever.
No, that's not the pharmacy. Okay, for this clinic, yes, but any town can request the pharmacies who are willing to come and do clinics for whatever ages their practices are appropriate for.
Right.
I've seen them go to, other types of like fairs and things like that were available due, I think, like from the age of 11 on up.
And that's
But this one
assuming-
in particular, we're just talking about seniors.
And that's assuming that there's going to be enough flu vaccine to go around.
Well, I think, Jerry, it depends if they're going to add it to the quad
Yeah.
strains.
You want to explain that, Kate?
Yeah. So every year, they evaluate the strains of flu, and they reformulate the highest strains into a formula.
Big guess.
right? So H1N1 had 2 strains, and now it's up to 4 strains of the vaccine that will protect against those 4 strains. So if it's going to be a regular flu season, if you will, with the 4 strains that they have developed and formulated, versus a single COVID specifically, versus if they put it together, because that's going to be huge in terms of how many people get it. And I've also read that the COVID might be a 2-step
No,
vaccine.
so no, my question was that I'm concerned that the regular flu shot will be rationed because everybody's going to be lining up for it. That's my feeling. I don't.
I think it's going to be prioritized again.
Okay.
I think they look at deaths, who's dying, like H1N1, who are the mortalities of influenza, and then I don't think that will be rationed. I think it'll be COVID if it's separate.
Well, yeah, that's. So Sue, what do you think Tammy should keep?
I don't have a problem with that. It's no charge to us. And the
How about
seniors,
you, Jean?
Are you
How about-
finished, Sue?
yes.
I'm with Sue.
Okay, so Tammy, you go ahead and you can. I don't think we need a motion. Tammy?
This is, I'm not even, like, I might be helping with, just organizing a flow or something like that.
Yep.
But this is completely, council on aging staff.
Yeah. Okay. So, yeah, go ahead and.
And I before we kind of sent people to the pharmacies, I did several for Cindy, and so we had a flow. I mean, we're not talking 500 people, but we probably did 80, 90, 100 people in those clinics. So we did have a flow of how people came in, they registered, they got screened, they got their vaccine, and then they had to sit 10 or 15 minutes to make sure they didn't have any type of reaction, and then they went on their way. So it's definitely feasible in that area, and if people needed to go outside, you could do tables outside, barring the weather.
Okay.
Cindy is going to have to create some kind of formula as far as, what Kate just said, people have to sign up. They could be assigned certain days, certain times. You can only have so many people in at one time, et cetera, and on and on. So she's going to have to come up with a very detailed plan on how everybody is going to be treated in this prior to, my total approval.
And that's what we've begun to talk about.
Yeah, I think.
One of the, I feel better about pretty much for anything out there. I feel better with pre-registration, and she's not opposed to it. And I think,
We
yes,
did
I
that
know
too.
people might show up early, but we're
Yep.
thinking of, maybe half-hour time slots.
Yeah, we
to
did
do
that
it.
too. And they had the people that checked those people in and then
Okay.
sent them through. We did pre-register.
And we're getting this week. I think Joe Didi and Russ Fox have arranged to put up some tents outside of Town Hall that are going to be used for different things that the senior center is using. So we were contemplating that we would be using those, rain or shine.
So Sue, Jean, can I get a motion to allow Tammy to keep working with Cindy about developing a senior flu clinic? And come back to us with what's going
Go ahead, Jean. Go
Yeah,
ahead.
I'm not sure this requires a motion. I think it's part of Tammy's duties to work with town employees as far as health goes. But if you want a motion, fine, Tammy, go do it. How's that for a motion?
Everybody votes yeah. I vote yes.
All right, I second it. Yes.
Jean?
Yeah,
Okay,
yes.
Go ahead, Tammy. You have our blessing.
Thank you.
You're entirely welcome.
And Tammy knows I have her back. Like, I'm going away again, but I'm not on a motorcycle. So I am there for, making sure Maven is taken care of and residents are taken care of, and Zooming if we need to, or conference calling, it doesn't matter. because I'll only be at the Cape. So that's totally fine. Whatever you need to make this work.
Okay. I
Thanks,
mean, we
Kate.
do it now.
Hey, I have a question.
Sure.
When you go into a store
Mm-hmm.
and the cashier is behind plexiglass,
Yep.
do they also have to wear a mask?
Well, that gets into the 6 feet mask, right? Because it's an either or. What the stores I have gone into, I've seen both. I've seen plexiglass and masks.
Well, I think what Sue's saying is that is an employee required even though there's plexiglass up?
It is.
Okay.
Yeah, I would say it is.
That's the
I
answer
would
to
say
the
it
question,
is.
Sue.
So what was the answer?
Yes, it is required.
Okay, well, the mobile station, every time I've gone in there, that man, I don't know what his name is, he does not have a mask on.
The guy that sits in the corner?
No, the guy behind the cash register
Guy
yesterday.
behind the cash register,
Well, he should have, he
he
should
never
the-
has a
have.
mask on,
So cashier at mobile?
Yeah.
yes.
Do you know his name, Sue?
He's a heavy, no, he's a heavy set.
That's okay. I'll go
talk to
in.
Tammy.
It doesn't matter who it is.
That's
You know
right.
who it is, Jerry?
I'll
Yep.
talk to Tammy later.
Yep.
But if the person has a medical condition, then they don't have to wear the mask, correct?
Mm-hmm. And they
Correct.
don't
This is
need
true.
documentation either. They
Okay,
can say, I have COPD and I'm not going to wear a mask.
okay, so that,
But at least the question should be asked.
Yeah, sure.
I can do I now have a standard inspection form, COVID inspection form I can do.
Rock on, Tammy.
plus I've seen
Good for
people
you.
go in that store and there's a sign there that they have to wear a mask. I've gone
Right.
in not wearing masks.
Jessica?
Hmm?
No, Jessica's light's on. I wonder, okay.
And lights on, what does that mean?
Kate, you all set?
I'm all set.
Tammy, anything else?
I'm all set too.
Peter, any questions?
Oh,
Uh,
Jerry,
Oh, wait.
I'm sorry, Jerry. Do you want the latest numbers?
Sure.
I'm sorry. I did not add that.
That was going to be my question anyway.
So as of 5:30 this morning, we have 63 positive.
And then what's that increase from 2 weeks ago?
I believe it's 1.
Okay.
I believe 1.
Okay.
As a result of that, those couple positives, now we're getting more contact cases, right? So when you ask, so say I call Joe Schmo, blah, 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 and who have you been contacted? Sometimes they'll tell me names, sometimes they will not, right? But the contacts that they will, if they do give me information and I follow them because they're in quarantine, we have 4 currently.
Was
There
that
could
from
be
the one
more.
case?
What's that?
Was that from the one new case or was it a different case?
Two.
Okay.
2. We still, thank God, we only have 2 deaths, and there is 1 person in the hospital that is critically ill right now.
Does the critically ill person have any underlying conditions, or is it
Tons.
strictly COVID?
Tons,
Okay.
tons.
Okay, so Kate, where were they exposed? From another
From us-
person?
Well, the
They know?
relationship is a household contact,
Okay.
but they don't go out, so someone must have gone into the home.
I think the problem in Southwick is that we probably feel too safe. I mean, we've been going along since February, March,
March
April,
March
May.
13th was our first
Yeah.
case.
March, April, May, June, July, August,
Yeah.
5 months and 63 cases. I
Mhm.
mean, so you feel almost, I should bite my tongue, but I think that's when we need to be the most vigilant.
Mm-hmm. I agree, because I think it could, my mind is, as a nurse in my brain, I always prepare for the worst. And I think we need to be, like you said, Jerry, very diligent, and we cannot let up, because it takes 2 or 3 cases positive And then there's a chain effect. And the issue that's coming up is asymptomatic people are still positive. And that's the crux. That's the thing that gets people really kind of insecure, because they're like, I didn't have any symptoms. And I'm like, I understand that, but you were exposed to someone that tested positive. So those close contacts need to be tested. They need to be tested. Before, we didn't have enough testing. Now they need to be tested.
And are they getting tested?
Yes, they are, because I check in them in Maven. I can check their names and see if they come up. If they're positive, I get alert. If they're not, I don't, but I can still check and see if they've been tested.
So
Okay, so
Sue,
this person who's positive, elderly, middle-aged,
Elderly, 77.
77. And then are there any, you said there's people in are the people in quarantine?
The spouse is in isolation.
Isolation, okay.
Yeah.
Elderly.
so Sue, when you go around town, you feel the same way I do, that most people are wearing masks, socially distancing? I mean, there's some that aren't, but I think for the most part, everybody's doing. a pretty
I
good
see
job.
most people that are. I do.
Sue, what do you think?
Unfortunately, I don't really go to town that much. I go the back roads.
Okay,
Sorry.
Jeannie?
Yeah, I've seen most people complying. But then again, you can't say Southwick people stay in Southwick,
No,
you know?
Yeah, exactly right.
So if you're a Southwick resident and you go someplace, you bring it back. What's to stop you from going, and what's to stop you from coming back?
It's just like E. coli, right? You don't know how you got infected, but people are infected with a diarrheal problem. But nobody, it's hard to get the source. That's the thing that's very difficult, is you can't say that's the source.
And everybody's not just staying home like they were before
no,
either.
well, that's not gonna happen.
Right.
Yeah, at least. Peter, you have any other questions?
Is the one person that's in the hospital the lone active case, or?
Yes, she
Okay.
still is positive, yes.
Okay. That's it. That's all I got.
Doug? Doug?
Sorry. I agree with well, I respectfully disagree about the quarantine if you've gone out of the area. And frankly, I think it's irresponsible. That's just Doug Moglen's opinion, not as a selectman. I think if you go out of town and then you leverage that to say, well, it's only guidance or whatever, and I'm coming to work, and you unnecessarily expose your entire workforce in the town of Southwick or whatever business you work in, that's selfish and just wrong.
Doug, if
My
they do-
opinion.
Doug,
So-
Doug, if they do quarantine and they're a town employee, will they still be paid?
No, I think it's
No?
part of your vacation planning. I mean, right now this is a pandemic, and I think if you're planning to go away for 2 weeks, you better have 4 weeks of vacation to do it. You know,
Mhm.
Everybody's life is turned upside down, and I don't think you have the right to just say, well, I don't have the vacation days, so I'm coming in and potentially exposing an entire workplace to this. I have an issue with it, and that's not town of Southwick. That's just in general.
Mhm.
And I think that's something to think about. I
Agreed.
personally, I wouldn't go to Florida right now, come back to work. I would do what it says per what would be the best practice for that. And fortunately I can. And if I couldn't, I probably wouldn't go to Florida in the first place, knowing that's the case.
And think about it, Doug, on the opposite end. What if your cousin, brother, father, mother from Florida came here? What would
See,
you do
That's
then?
it's a
They
tricky
have to
thing. I agree with you.
quarantine. They have
They
to
should
quarantine.
quarantine. And are they going to quarantine in my house? And then that's no good either, right? So I don't know what's the right answer for that,
Yep.
right?
It's a personal responsibility piece in a pandemic.
And a lot of it is, I mean, I find myself in some place, personally, where, I found myself in a couple situations wearing a mask and look
Mhm.
around and I'm like the only guy, or, you know,
Mhm.
there's a few, but not everyone. And you're like, oh, this is probably not a place I should be hanging out. Right. And,
Yeah.
Right.
you know,
Yeah.
but
I agree.
and other times, you know, you have to, and to Dr. Asia's point, I think he brought it up earlier, you know, we've had a very low number of cases, but it doesn't take much, you know, and it could just be, hypothetically, a not smart person that you're standing next to somewhere that just came back from Florida and you didn't know it. And
You don't
how
know.
could you know, right? You can't tell by
Right.
looking at someone that they were just in Florida or that they're asymptomatic or what have you, right? And you could have a real problem on your hand. So
Mhm.
that's just
Mhm.
Doug Moglen's opinion, nothing to do with Board of Selectmen. So, and, you know, I defer to Carl and smarter people than I about, you know, HR rules and the unions and what have you. But I just think from a personal responsibility standpoint, I would alter
Mhm.
my vacation plans at this point based
Right.
on the knowledge of what what I could possibly do to somebody else, not even
Mhm.
myself.
Mhm.
Okay,
That's
I
it. I'll get
agree.
off my soapbox.
No, I agree with you, Doug.
Jessica, anything?
We
Nope, I
actually-
don't have anything.
We actually
No.
had a case like that where someone did come back from Florida, came down with it, exposed somebody else.
Not in town.
No, not in town.
Could have been.
But it does happen.
Yeah.
Yeah, it does happen. I mean, there was a case a few weeks ago where a whole group of people went down because they wanted to celebrate a wedding thing or whatever. They come back and 3 of them are positive and they've exposed all their family members. That's not being a responsible citizen. And I did everything I could to have self-control, but I was a little irritated. Because they knew that Florida is a hot spot. So now, not only are they infecting or potentially infecting, you know, these people, but what about the other people to the other people? It's a ripple effect. It's not just, you know, if someone has HIV, you know the risk factors and how you catch it. And this is completely, you know, not that. So I think people need to be really careful and not be selfish. I agree. This is not all about the person going to Florida.
But until it's mandatory, it's not going to happen.
Well,
Mhm.
They'll have a tough time legislating that, I believe.
Right.
We
okay,
can't get people to wear masks. I don't know.
all right,
Yeah.
let's move
I
on.
get it.
We're not gonna solve it, we're gonna solve it today.
Yeah. Exactly.
Tammy, is there anything else you wanna, add to the meeting?
Yes, thank you to Jessica for doing such an amazing job working in the office, going through all of the files and organizing the cabinets. I didn't realize it was going to be so extensive, but thank you so much.
You are welcome. It'll be great when it's done 5 years from now.
Do you see the new building inspector, Tammy?
Say that again?
You see the new building inspector? I haven't met him.
Yes, I have.
And all is well?
All is well. He's a
Good.
very nice gentleman.
Good. I'm glad.
Kyle Scott is his name.
Kyle Scott.
Okay,
Good.
Joe's on mute, so he can't say anything. All right, I'll take him. Tammy, anything else? I'm sorry.
No.
Hey, I have something, Jerry. Did you work on the 6-month evaluation?
No, I didn't. I'll have it for the next meeting. Okay,
Pinky swear.
I'll have it for the next meeting, Dr. Johnson.
Thank you.
Are you working with it with Jessica or online or? looking-
I'll have an evaluation form for you guys to fill out before the next meeting.
Okay, next meeting is August 6th.
Mhm.
I may not be in attendance.
Okay. Okay,
Can we
let's
change
just have it.
to
No, let's have
another
it.
time so you can be?
Huh?
Who's talking? Can we change it to another date so that you can be in attendance?
You want to take it through the Wednesday? Because can you come on the 5th? Because we're not bound to, we don't have to
Right.
worry about a room.
Mhm.
Right.
I couldn't do the 6th either.
Yeah, the 5th is okay.
How about
Is the
you,
5th okay with you?
Mhm.
Tammy?
Tammy?
I've got nothing else to do.
Okay, so,
Jessica.
next
Yep.
meeting- oh, I'm sorry. I'm sorry.
Don't forget me.
I will never forget you, Jessica. You're right here on my, I have the picture up on my wall. It's 3x5. It's 6x10. My wife wants me to take it down, but I refuse. Okay, so our next meeting is August 5th at 6 o'clock.
Tammy, you'll send a reminder out, please?
I certainly will.
Okay, before we go, when do you think the schools are going to come up on our radar? I know she's doing graduation a week from Saturday. I understand that we have a fairly good plan for that. So. are we
I
gonna
have
be-
been in contacts with Superintendent Willard trying to decipher what the guidelines that the DESE has put forth so they can get their plan together.
Okay, now, do we have final approval of that, or we have no say whatsoever?
I don't believe we have final approval, no.
So we're just onlookers. Is that correct?
Onlookers, but I'm also helping.
Okay, that's fine. Sue, you think that's okay?
Yeah.
Okay,
I think the final approval is the Department of Education.
all right. So that'll be that. Well, we'll see how it fares out. It'll be interesting. All right, I'll take a motion.
I'm already not liking it. Just it's making me so nervous.
I get a motion to adjourn.
I'll make a motion to adjourn at 6:58 PM.
Okay, second. Sue?
Yes, second.
Okay, yes.
Yes for Sue.
Yes,
Sue,
Regine.
Okay, night, everybody. Yes,
Okay, have a
Night.
good night.